Before the COVID-19 pandemic, some 15,000 people, including migrants and refugees from Zimbabwe and other countries, truck drivers and travelers, crossed the border from Beitbridge daily through either the official border post or illegal crossing points. MSF recently released the Limpopo Mobility Survey with the objective of providing reliable evidence on migrant journey pathways and how these journeys link with migrant health outcomes. Now, let's talk about this further and the findings, of course, of the survey. We're joined by Rinako Uwenishi, project coordinator for the Doctors Without Borders migration project at Beitbridge. Rinako, thank you so much for your time this afternoon.
Thank you very much for inviting us.
Now, let's talk about this recently released results of the Limpopo Mobility Survey report. Talk to us about the study, first of all, and some of your findings.
Okay, so we conducted this survey around the Beitbridge town, and then also the other side of Beitbridge town, which is Musina. So we had an interview with 1,500 some people to ask their experiences as a migrants in South Africa. So this survey result highlighted challenges of migrants living in South Africa.
So what are some of the findings that you found?
Okay, so according to the survey, half of the migrants who lived in South Africa in the past had a xenophobic attitude in their life in South Africa, and then also many of them had at least one episode of physical assault. And then also another highlight from the survey is the detention experience of migrants. So every quarter, around 2,000 people are deported from Lindela and then other detention centers. And then 17% of people had sexual assault in detention center, especially the Lindela detention center, which is quite surprising.
Now, in my intro, I read that, your evidence is on migrant journey pathways and how these journeys link with migrant health outcomes. Talk to us about that link. What have you found there from a health perspective? Okay,
so when the legal pathway to obtain the work permits, of course, it increased illegal migration, which also naturally increased the vulnerability of migrants. For instance, access to healthcare or access to a basic social service. So this caused, for instance, interruption of medication. For instance, those who are taking ARV, they are not able to access to healthcare to get their ARV. Even for the woman who needs antenatal care and so on, which are supposed to be guaranteed universally. So this is the concern. And then also the survey says that why people are detained in the detention centers, people had a very limited access to healthcare in the detention center, and then also had to live in a quite poor living condition. So this could be the consequence of migration journey in South Africa.
Rinako, we mentioned that before COVID, there were about 15,000 people who were, crossing the border just at Beitbridge. I mean, these includes migrants, refugees from Zimbabwe and other countries, as well as, truck drivers and travelers, etc. But according to your findings, what are some of the reasons people flee their country of birth?
Okay, so in Beitbridge locality, most of them we see are from Zimbabwe. Of course, there are some international migrants, including Malawians and even some people coming from Asia. But if you look at the Zimbabwean migrants, this is also related to the challenge to get the job, and then also the opportunity for work and then schooling and then so on. So this is the main reason why people want to get the opportunity in South Africa, which is relatively have a better opportunity in terms of getting job.
Now, you speak of the pressing needs that migrants need, especially in this country when they come here. What are some of the solutions you have on the table, particularly where it comes to government?
So our main concern is related to medical and then the humanitarian needs. So unfortunately, we don't have a solution for the government. But for instance, recent decision of the South African government not to extend Zimbabwean exemption permits could potentially increase the humanitarian and medical needs. So this is our concern. And then potential scenario which could increase the humanitarian medical needs could be considered by the government.
But you've released the Limpopo Mobility Survey. So who have you then released it to? I mean, who do you want it to urgently go to so that we do find the solutions? I mean, some of the problems and the findings that you're bringing onto us now are quite concerning.
Yeah, indeed. So we have the team in South Africa. So we have been having dialogues with the authorities, also to share our concerns and then also to find a solution. So this could be ongoing, and we are hopeful that we will find a solution.
Rinako, thank you so much for your time this afternoon. Really do appreciate it. And that is the project coordinator for the Doctors Without Borders Migration Project at Beitbridge, and that's Rinako Uwenishi. Thank you so much.
Thank you very much.